Hi, in this video, I just want to go over two misunderstandings or myths about empty nose syndrome that are really common. The first one is that it's caused by complete turbinate removal or large reductions only, and that's not true. It can be caused by conservative procedures. And the second one, they kind of go hand in hand, the two myths. The second myth is that we know how to prevent empty nose syndrome, and that is also not true. So this first clip, it's a doctor talking about the cons of a turbinate reduction.
Cons of a turbinate reduction. The cons of turbinate reduction are few. Very rarely, patients may have empty nose syndrome. This happens when the surgeon does not have as much experience with turbinate reduction. In these cases, the entire or almost the entire turbinate is removed.
And then here is Dr. Jang's experience with patients who have empty nose syndrome.
The diagnosis must be based on the history of turbinate surgery, loss of turbinate volume, but sometimes the patient has not that much volume reduction.
Here's a quick screenshot of, it's a quote from Dr. Hauser, but he discusses how even after conservative procedures, you can still have empty nose syndrome. In this next clip, we have an ENT saying that what are the risks of turbinate reduction, and basically saying there is no risk of empty nose syndrome. Just straight up saying that.
There are no disadvantages to doing a turbinate reduction. There is no risk for empty nose syndrome, and the benefits are great.
In this next clip is Dr. Nayak. He works at Stanford University. He also treats empty nose syndrome. He sees patients from all across the world. He's one of the leading experts on empty nose syndrome. He also does turbinate reduction, and every once in a while he does have one of his own patients experiencing empty nose syndrome. Just keep in mind, I did cut this clip a little bit to shorten it up, so if you want to get the full clip, yeah, just click the link for it.
I think that my numbers speak for themselves. I think that having 3,000 plus turbinate reductions, that means about 1,500 patients who have turbinate reductions and two sides each. You have to usually do both. That's how I get to 3,000. So 1,500 patients, 3,000 turbinate reductions, and I think I've gotten tissue loss unexpectedly in about 3 of those patients. Why that happened, I don't know. But in 2 cases, I think I've had to do something about the empty nose syndrome part of it, and I can talk to you about that.
So in conclusion, according to the empty nose syndrome experts, conservative turbinate reduction can cause empty nose syndrome. And the second thing is also true. No one can guarantee that they will not cause empty nose syndrome.